Dr. Abhijit Patil. I'm basically a radiologist. Recently joined Krsnaa Diagnostics as VP Radiology. So we have two vertical. One of my counterpart colleague of pathology, Dr. Manish, is also here. So I would be just brushing up upon the IT related activities which are happening in general, not only in radiology, but in the medical fraternity, and just stress upon radiology as I'm a radiologist basically. As we understand that IT in healthcare, as we commonly known as telemedicine, is not very new. It's been since a long time now. It's especially came into focus when as we always try to imitate the Western world, they started digitizing everything. So we also felt that IT, when we want to digitize, why not bring IT in toto? So, and I think the SARS-CoV-2, COVID pandemic has forced us and taken us many leaps and bounds ahead to imbibe IT in healthcare, which would have taken several years, I think. So what is basically information technology in healthcare? It encompasses several faculties or several departments. But this has both advantages as well as disadvantages because it encompasses computer science, electronic engineering, information data sciences, economics, and basically medical healthcare also, including clinical medicine, public health, and epidemiology. Why I say? Because I think without computers and electronics, transfer of data, storage, without economics, viability of such technologies, and without medicine, I think all this for what we are doing. And this etc. stands very important because there are n number of contributors which are still not in picture, but eventually we would require the whole ecosystem to run to imbibe this into the healthcare system. So the areas where or the advances in technology which are contributing to IT in healthcare are electronic health record systems, IoT, Internet of Things, AI, ML. So basically, while talking all this, sometimes I feel I am a radiologist or am I an engineer? So as you all know, radiologist and pathologist, who are investigative branches, they are the most advanced, or they are able to imbibe IT in their system very easily because we deal with pictures basically, and pictures are nothing but pixels. Pixels are nothing but some coded softwares where we can calculate and count them. Hence, they are very easy. Otherwise, an operative procedure for a robot to imitate a human would be more difficult than to actually diagnose an X-ray or a pathological slide. So I think AI and ML, as we know, radiology can be counted in pixels, in HU values, in terms of your ROIs, which are used in several parameters for different investigations of MR also. So wherever you can measure, you can imbibe IT or artificial intelligence to teach the software. Hence, I would like to stress upon artificial intelligence first. Basically, though we have come to know about this term recently, it was basically coined by a Professor John McCarthy while doing his professor post in a Western US university, and he had done this to solve small problems. So basically, after they came to know, okay, these are small problems which can be solved by softwares, why not bring on to larger problems? And today we are ending up using it for even personal healthcare and research and several aspects. So basically it involves teaching of the machine with a huge amount of data and helping it analyze unknown data. So it is basically, now we are teaching it. There will be a point when the machine will start learning with the data it encompasses or it comes across in everyday scenarios. For example, if I teach an AI software with 1000 X-rays, the 1000 first X-ray might also be totally new to the system, but the AI system, with the help of algorithms, will be able to diagnose that 1001 X-ray also, even though it has features which might be slightly different from the data fed to it. So, what are the applications of AI in radiology? These are the common applications. Now, I would say that we are in an infancy. We are yet to grow. Still, we have done quite a lot, especially in last 2-3 years. We have progressed with leaps and bounds. It's commonly used for diagnosing lung lesions, as we have come to know. We have seen several softwares in this pandemic which were used for diagnosing lung lesions, especially in X-rays and CTs, because we had such huge number of X-rays done because X-rays were the screening modality and not everyone could afford CT, of course. Like people were going right, left and center advising CTs, but CTs were not available everywhere. And there were thousands and lakhs of X-rays happening. I would say lakhs because at Krsnaa Diagnostics, every day we have done 10 to 20,000 X-rays during the COVID times, and still they are increasing because awareness about radiological investigations are increasing. So it's helpful in diagnosing lung lesions with the help of X-rays and CTs. It's helpful in diagnosing brain lesions, characterizing brain lesions, brain volumetry. It also has multiple algorithms. We can feed multiple algorithms to the software which can analyze which can come to conclusion about different diagnoses. We have heard about people using AI software to come to conclusions regarding treatments in COVID, which could be innovative. So these all were part of AI system. So benefits are that it is very helpful in screening. It cuts down the TAT time. So it can also quantify. If you teach the AI system to quantify mild, moderate, severe, it can do that also. So this is the most common example which you might have read and seen during the COVID times, that AI system being able to diagnose pneumonias on X-rays and CTs. The AI system finds out the lesion, and so we can use this AI to screen in times of pandemic, where if we are doing 1,000 X-rays a day, the AI would screen those 1,000 X-rays, filter out the positive and the normal, and the doctor, it could be left to the doctor as of now, because there are no regulations and authority have not, there is no accountability for AI reports. So hence, they could help in prioritizing the cases which are to be given on priority basis for critically ill patients. So, but there are several challenges to this. So wherever we know IT, it has computers involved, and computers processing such huge amount of data without data loss. It requires a lot of strength of that computer in terms of the CPU capacity, in terms of data storage. Trust deficit. So like we are teaching the AI system with the help of a particular data set. And what if that data set does not actually carry the sample size or the sample of that particular area? For example, if the AI is given MRI of the spines of say Spain, Middle East countries, where a spondylodiscitis would represent brucella. Whereas in India, any spondylodiscitis, 99.9% it would be tuberculosis. So such data collected from different geographical with different ethnicity, such sample size could be a confounding factor, and hence the trust deficit is still there. But as we are evolving, India, we are coming out with different standards for data storage, and we are coming out with softwares which are indigenous with having our Indian data set. So also as we doctors, so radiologists, I think one of the most techno-savvy class of the doctors, I would say, because they have to deal with computers. But it's very difficult. I have learned all this computing related, most of the computer related thing other than internet after joining my MD. Because initially during our MBBS periods, we were just taught about our subjects, core subjects. But now with advances, people are bringing these hybrid modules. They are encompassing economics, they are encompassing, incorporating IT related topics also, so that we become tech savvy. So, but there are other problems also, such as data privacy, bias, data scarcity for teaching the AI and ML model. But apart from all this, there are challenges where the system has to be taught. So now when the system will learn when the doctors are clear. So basically here, as you say, this is a case of meningitis. However, if the data regarding contrast MR is not fed, so the last two images, you can say these are contrast MR, where there is enhancement of the vessels in the subarachnoid space. If I do not tell the AI system that this is a contrast, the AI might diagnose this as subarachnoid hemorrhage. So we have to be very careful while training. The data has to be very good, filtered and structured data. Otherwise, there is no use of having data in lakhs of gigabytes and terabytes and this thing, which if it is not structured, if it is not labeled properly, if data mining is not done properly, then it is useless. So it is like having say a real diamond scattered in pieces of glasses. So the data have to be very structured. So we should insist on, wherever we are going to apply data, wherever you are collecting the data for AI system, it be structured, it be labeled in a particular format so that you can use it. So this is another example where it can be a confounding factor to differentiate between having two diagnoses. So in this, the first row A shows a plain CT where we can see there is hyperdensities in the sulcal spaces, but this might mimic on the first instance as subarachnoid hemorrhage, but this is just prominent vessels. This is a case of hypoxemia, because of which the vessels in the brain are dilated because of increased blood supply to compensate for the less oxygen in the blood. So if the AI system is taught anything hyperdense in the subarachnoid spaces is subarachnoid hemorrhage or meningitis, it would end up saying this is meningitis. So you need a lot of work to be done, a lot of structuring of the data, a lot of filtering, data mining has to be done. So we are, again I would stress, we are still in infancy, and this should not lead to any, these errors or our infancy in our knowledge or our ignorance should not lead to the lives or culminate in something erroneous which would endanger the lives of a few people. So this was a case of actually dilated vascular system in the brain because of hypoxemia, which did mimic like meningitis. So this is a case of tumefactive demyelination where it appears like a tumor. So in this case, especially if I would say this is a immunocompromised patient, then this very much would first be given as lymphoma where there is periventricular subependymal spread. But if someone says this is not lymphoma, I would say this is demyelination. So a lot of ifs and buts regarding presentation, the ethnicity, the common diseases present in those areas do account or do contribute significantly for the ultimate diagnosis, and hence it will take time for the AI system to be able to learn such minute things, such minute details, incorporating the clinical inputs, the hematological, all data together and then giving the diagnosis. So we do not usually give diagnosis for the image. As a doctor, we give diagnosis for the patient. So hence a clinical history, we always write in reports, correlate clinically. That is not for only to save our skin, but it is really, there can be many confounding images because after all, we are just looking at indirect shadows. So electronic data health recording systems, this is one of the parts of IT which I would not stress much because I think it is endless, but all this is required in terms of IT in healthcare where it needs to be structured. There have to be some common points where exchange of data, if at all, has to take place. For example, if a patient is transferred from one hospital to the other, how the data is transferred, how the demography is transferred. So it has to be on a standardized format. So there are these challenges, and also there is a feeling of burnout with this incorporation of IT, because while we are talking to the patient in a clinic, in an OPD, we are more bothered about recording the data rather than actually looking at the patient, examine him clinically, ask for the history. So there is a feeling of burnout around in the doctors where they cannot concentrate on their core subject, that is the clinical history or the treatment. So IoT or Internet of Things is one of the other areas where which plays an important role of IT being incorporated into healthcare, where there is real-time transmission of data. As you said, I think Sir had showed some monitors where the data is transferred real time to other places from one place to the other. So the concept of intelligent ICUs, they are coming up, where an ICU in a remote place, the real-time ECG monitor, the BP or the SpO2s are transmitted real time to intensivists who are remotely located, or experts who are remotely located, where they can monitor and suggest treatment. They need not be there at the bedside of the patient. So as we know, there are n number of applications where we are already using, and however, without knowing how our data is being used, where our data is being used, whether it is anonymized, whether it is non-anonymized, whether I can have any legal, where I can proceed for any legal challenges, whether someone would sue me or someone could take disadvantage of my readings or findings also. So other challenges in IT include commonly cost, cloud computing, where you need to store a large amount of data because all the data cannot be stored on servers, or because they are not in terabytes or this thing, they are huge. So again, in special situations such as mental health, physical examination of patients, and also special maneuvers and tests where the doctor has to be there. So all these places need, they are special challenges for incorporation of information technology into healthcare industry, which have to be would be addressed down the line as we advance in these areas. So apart from all this, other important challenges are standardization of the instruments, some ethical and social acceptability, accessibility and affordability also. Of course, like all people are more of business-minded people. So you must have heard about Amazon effect. So anything, whatever is innovative in this industry, everyone thinks how Amazon would disrupt your business plan. So that is how a competitor, or how any alternative to your device, to your data would disrupt. So today we are saying this is the right direction. We might turn up that this is not the right direction at all. We might have to take a U-turn. So we have to be prepared and select the path forward as it comes. So we are going in a we are blinded as of now. We don't know where you're going to reach, because as of now, we can see the things which we are seeing. A driverless car, this was just an imagination. This was just a fiction, but now it's a reality. So as we advance, acceptance of IT in healthcare is increasing. So with some surveys being conducted all over the world, one of which was done in 2016, it was found that people are accepting, and the acceptance, I think it has gone several times more, especially after the pandemic, where people found it more convenient to go for to use technology into healthcare also. So as I said, artificial intelligence is the thing and most disruptive technology in healthcare industry, followed by IoT, 3D printing, robotics. So now with the advent, now even countries have accepted that it is inevitable. Even the doctor fraternities have accepted that it is inevitable that you incorporate AI into your systems. They are not there to replace doctors, but they are there to assist you. So with all this in mind, I think even our government of India is taking steps to standardize all these procedures to bring them under legal ambit. So they have set up EHR standards, notification of which was brought in 2013-16. There are digital standards. There are consumer protection laws for all the digital data that has been accumulated. You can get this reference on government websites also. So I think we are going in the right direction. And especially after the pandemic, where India has come to the center stage, not only in pharma industry, in healthcare industry, we have proven to the world that with our holistic approach and our advancement with Ayurveda also, we have been able to curtail the pandemic to an extent much better than what panic we had seen in the European countries, the so-called advanced countries. So to conclude, Information technology and medicine are ever evolving, and the concepts which were fiction are a reality now. We should accept, however, there are some glitches which need to be addressed, as this could lead to polarization of service providers, and also the accountability has to be fixed as of now. So any report which is generated from an AI system or from with the help of an IT device, its accountability has to be fixed. So as of now, we have no strict rules governing these points. But however, our government is taking appropriate steps to bring into the legal ambit the reports, as well as the companies which are manufacturing these gadgets. So as we know, computer, internet, they were disruptive in their eras. Digital currency is disruptive in the present era, and I think the next era is digitization of the healthcare industry. As doctors, I think we should be the pivot of this disruption, and we need to accept and take it forward. That's it. Thank you. Thank you very much.